Urinary tract infection. Is it very dangerous? It hampers the fertility? Yes. It looks like a small infection, very small. What is urinary tract infection? When the urinary tract gets affected with certain organisms, maybe E. coli or Pseudomonas, there are many other organisms, maybe bacteria, maybe fungal infections, all these things, they will get infected, that part will be get infected, and urinary tract and vagina, that reproductive system are just nearby. So usually if vagina is getting affected, if it gets affected by intercourse and maybe the husband's spermatozoa is just going inside along with the semen, there may be some infection which may be going through intercourse into the female part, then usually the female partner will get the urinary tract infection very soon. And even few people, whenever the female is suffering with the urinary tract infection also, they will go for the intercourse, and which worsens the scenario much more. Usually in urinary tract infection, what the female will get the frequency of micturition, burning micturition, and very small amount of urine will be passed, and vaginal discharge, and smelling discharge, and vomitings, fever, and chills and rigor sometimes, and lower abdominal pain, many more. And this is really very worst situation if the female partner is not going to the doctor, and if the male and female both are not getting treated very properly, this will end up in a very big problem. Even the fallopian tubes will get affected, the fallopian tubes will be closed, the surrounding structures of the uterus, ovary and fallopian tubes and intestines, everything will be attached, that is small adhesions will form. So tubes will be very small, so the tubal problem will be more. The pelvic inflammatory disease, urinary, if the tubes are very sensitive, if the all reproductive system parts are very sensitive, because certain females they are very sensitive, certain females they are not very sensitive. So very sensitive females will be getting affected very seriously, and the fertility problems will occur. They won't get children. So either it is urinary tract infection, either it is the vaginal discharge or smelling vaginal discharge, you have to go to a gynecologist as early as possible, immediately. Both partners should go, because both partners should be treated at the same time. If wife gets any infection, husband also will get, husband gets any infection, wife also will get. But for the husband part, actually the infection will not come into the scene immediately as early as possible like female, because they are having long urinary tract. So what you should do whenever there is any infection? You should maintain the inner hygiene properly, you should wear the cotton panties and you should change it very often, and whenever you go for intercourse and immediately you just wash out the particular area, and the males should clean the prepuce and every part, like the glands also, the penis parts also, it should be cleaned very properly every day during bathing and all, and they have to clean the glands penis very properly by doing the eversion of prepuce. And then afterwards the female should take more water, maybe male, maybe female, should take more water, more buttermilk, more coconut water and more buttermilk, minimum 20 glasses of water, 20 glasses of buttermilk or coconut water, and then they have to pass their urine immediately, and after every voidance of urine they have to wash it properly, and they have to use the cream, candid vaginal cream or something cream which is prescribed by doctor. They have to keep in vagina very properly, they have to take the antibiotic very properly, and they should not go for intercourse for 1 week period, and both wife and husband should take the proper drugs for 1 week period, minimum 1 week period, and they should not get any kind of urinary tract infection so often. They should even take vaginal probiotic along with the antibiotics. Though antibiotics actually what they will do, they will harm very natural protective mechanisms, protective organisms which are there in the vagina or which are there in the system. So, you have to take vaginal probiotics and afterwards antibiotics and afterwards lot of water and like citralka like things, alkanizers, urinary alkanizers and spasmodic drugs, antispasmodics, because you will get very spasmodic kind of pain. So, that is the reason antispasmodics also you should take and you should come out of the problem.